Thank you very much. Good afternoon, everyone.
Good afternoon.
I am very honored to be here this afternoon. My name is Irene Mbabazi, and I am a medical doctor with the Infectious Diseases Institute in Uganda, Kampala. And I work, it's under the Makerere University. I'll be presenting to you the factors associated with unawareness of HIV status and recency of HIV infections among women living with HIV. These were findings from the population-based surveys in 13 African countries. Okay. So HIV testing is a critical entry point for both treatment and prevention initiatives, particularly among adolescent girls and young women who are disproportionately affected with HIV within sub-Saharan Africa. However, despite the multiple efforts that have been put into increase HIV testing availability, there is still a significant number of women living with HIV who remain unaware of their status. So this study aimed to explore the demographic, socioeconomic, and clinical characteristics of women living with HIV who are unaware of their status across 13 African countries. Yes. So the methodology, this was a secondary analysis of data from the population-based HIV impact assessment surveys, or the FIAs. And the surveys employed a two-stage cluster sampling method to ensure national representation and to avoid selection bias. And data was collected from individuals who are greater or equal to 15 years of age. During the survey, face-to-face interviews were done. Home-based HIV testing and counseling was also carried out for everyone, regardless of whether they reported to have HIV or not. And a weighted chi-square analysis and log binomial regression were used to identify associations between HIV status, recency of the infections, and the various factors, as we shall explain. Okay, so a recency of HIV infections was determined using the avidity antigen test, as we can see. So the avidity antigen test is measured using optical density. So if the optical density was greater than 2, then one was classified to have long-term HIV infections. Long-term infections are those were classified as those which were greater than 12 months or 1 year. And then if the optical density was less or equal to 2, then the avidity test was repeated in triplicate, which was the confirmatory test. And then the median optical density was acquired. And if it was greater than 1.5, then one was confirmed to have long-term infection. And if the median optical density was less or equal to 1.5, then they went on to do viral load, HIV viral load. So if the viral load was less than 1,000 copies per mil, then they went on to classify that as a long-term HIV infection. And if the viral load was greater or equal to 1,000 copies per mil, then they went on to test for ARVs in blood. So the ARVs tested for depended on the regimens that they were using in those particular countries. They chose 3 ARVs, both from the first line and the second line regimens in the different countries, depending on what they were using at that point. Yeah, so if ARVs were detected in blood, then that was considered as a long-term infection. And if there were no ARVs detected in blood, then that was considered as a recent infection. So those were the number of the countries that were included in this survey, 13 in total, including Uganda, where I come from. So the results, among the 27,983 women that were living with HIV, 26.6% of these were unaware that they were living with HIV. And of these, 94.8% had long-term infections. East Africa had the highest proportion of women who were unaware that they were living with HIV. And women with recent infections were more likely to be unaware that they were living with HIV. As we can see, the p-value was quite significant. Yeah, so this is just a graph showing the recency of HIV infections among women that were unaware that they were living with HIV. So 5.2% had recent infections and 94.8% had long-term infections. So the factors, so from the analysis, the significant factors that were independently associated with unawareness of HIV status, we have age. So compared to women who are 15 to 24 years, this age category, 25 to 55 years, this age category of women were more likely to be unaware of their HIV status. And then compared to women residing in urban areas, women in rural areas were more likely to be unaware that they were living with HIV. And then compared to women who were never married or who were divorced, being married was a significant factor. So married women were more likely to be unaware of their HIV status, probably because you trust your partner and you don't go for testing. So, and then compared to the people in the poor category of the wealth index, the rich category of wealth index, they were more likely to be unaware of their status. And then having no sexual partner in the last 12 months was also a significant factor. And probably this may be attributed to the fact that these people usually perceive themselves to be at low risk since you've not engaged in any sexual activity and you're feeling okay, so you don't see the need to carry out testing. Okay. And then non-condom use at the last sexual encounter within the last 12 months, that was also associated with being unaware of one's status. Yeah, so this is a graph showing the unawareness of HIV status by age category, and we can see women between 25 to 34 years had the highest percentage of being unaware that they were living with HIV. Okay, then we also determine the factors that were associated with having long-term HIV infections among women that were unaware that they were living with HIV. So these factors below were significant from the analysis. Women aged 25 to 44 years, and then having no sexual partner in the last 12 months still, non-condom use at the last sexual encounter in the last 12 months, and a CD4 count of less than 200 cells, compared to those who had a CD4 count of greater than 500 cells per millimeters cubed. So in conclusion, in sub-Saharan Africa, there is a high proportion of women who are unaware that they were living with HIV, majority of whom had long-term HIV infections. Delayed diagnosis and treatment initiation may contribute to the progression of HIV infection to advanced stages of the disease. Among these, and this may also contribute to an increased rate of HIV transmission since you continue engaging in in sex without protection because you don't know your status, so this may increase the rate of transmission. And in order to meet the UNAIDS First 95 target, which is about testing, HIV testing interventions should be tailored towards these categories of women in order to improve early access to both HIV testing and prevention. Yes, I acknowledge the population-based HIV impact assessment surveys for giving us access to this data. My mentors and the Fogarty Scientific Writing Workshop, which is sponsoring writing of the manuscript, sponsored by the NIH. Thank you.